Hello everyone, first thing I'm going to be teaching you today is called the active cycle of breathing technique. The idea behind this is for those of you that might be struggling with breathlessness at the moment to help try and clear your lungs in a sort of slightly more relaxed way rather than sort of excessive coughing, which can make the airways a little bit more irritable. The idea of this is to change the way that the air goes into the lungs and use a different type of ventilation which will get behind some of the secretions that have built up due to infection, and then we should be able to help clear the secretions out of the chest a bit more easily. So there's a couple of composite parts of this that you need to kind of put together, and you do it as a cycle, and essentially depending on how you're feeling after one cycle you can then do more reps. It all really depends on how you're feeling, whether you're feeling a bit more breathless after doing it in a way you want to take a bit more of a slow approach. So first part to go through is what we call tidal breathing or normal breathing, which I would suggest use your nose because that's what it's there for. So normal, nice breaths. Don't try and think about breathing in deeper than normal. Don't try and breathe out longer than normal. Just as easy and relaxed as you can. The second part of it will be a deep breath in, again through the nose. And then I want you to hold. The holding will allow for some of the air to dissipate into the blood system, which in turn will mean you can get a bit more air in. So you need to hold 3 seconds, and then we're going to do a little sniff, and then we're going to breathe out. Deep breath in, hold 3 seconds, and sniff, and then breathe out. I tend to sort of have a bit of pursed lips when I breathe out rather than breathing out through my nose. Adds a little bit of resistance, makes you work a bit harder, helps train up those lungs a little bit. Deep breath in, hold for 3 seconds, and breathe out. And then I'll go back into that tidal breathing again, normal, relaxed breathing. And then we're going to introduce something called a huff. A huff is a bit like a cough, just with a lot less pressure. And the way you do this is you make an O with your mouth, and you basically do this movement. So it's like, I always describe it like you're trying to blow out candles on a birthday cake that's on the other side of the room. For those of you who had a peak meter sort of reading in the doctors when you've been suspected that you might be asthmatic and you breathe into that tube, it's the same sort of procedure. So again, breathe in, nice big deep breath in, and then huff. And then deep breath in, and then huff. What I would tend to do is I would make them into a cycle of normal breathing. Let's say we do sort of 10-15 seconds of that, 3 big deep breaths in, then followed by a huff, and you would do that as a set, and then you would do that say 3 times, and that's you done. And that's you done. We'll do that a couple of times a day maximum. Again, if you're starting to feel a bit breathless during it, pump the brakes, don't do as much. Maybe try just 2 sets, or even just try 1 if need be. You might cough after this, and that's absolutely fine. It's designed to kind of get the phlegm moving in the chest, so if it does end up tickling the throat a bit and makes you cough a little bit, don't worry about it. If you feel like a bit of a coughing fit and you're a bit breathless afterwards, again, pump the brakes, wait, and then do it again later on. Okay? Thank you very much, guys. And that's your active cycle of breathing technique.